If I'd known how many people there were going to be here, I probably would have said no when Jorge phoned me up and said, would you mind coming along and telling your story? I said to him, how many people have turned you down? And he said, actually, you were the first one I asked. So I thought, oh, wow, that's nice. So obviously, we're all very different. You've seen all the range of neuroendocrine cancers. I was diagnosed in 2005. I was 54 at that time, 63 now, in case you're quickly working it out, with a non-functioning pancreatic neuroendocrine tumour. It's one of those slow-growing ones, as Professor Kaplan was saying, and I think the first inkling I probably had of it was, well, definite inkling, although I didn't know it at the time, was in 2002 when I had some indigestion-like pains and pains here, and I went to our GP, and he sort of thought it might be a heart and did an ECG, which turned out for some strange reason to be slightly abnormal, and that's what was concentrated on. It's now perfectly normal, but at the time I had some liver function tests done, and some of them were slightly abnormal, but we all thought it was within the normal range. Obviously, that was the cancer then, showing its head, its ugly head, I might say. So I was eventually on holiday in October 2004, abroad and in America actually, and I felt really unwell. And you don't want to go to a hospital in America because you know it's going to cost a lot of money and you've got insurance. So I came home and I went to the GP, and to cut a long story short, I was referred to my local hospital, Luton and Dunstable, and I got the final diagnosis on January the 26th. I think you'll remember the date, don't you? 2005. And I was given the option of either going to Addenbrooke's or the Royal Free, because that particular consultant had only ever seen one patient with neuroendocrine cancer before. He didn't know where was the best place to refer. Because it's easier to get here where I live, coming on the transport rather than driving to Addenbrooke's, I chose the Royal Free, and I've never regretted it, I have to say. So I started treatment. I saw Professor Kaplan. I started treatment in April. Had 6 sessions of chemotherapy, 4 weeks apart because my blood count went down. And then my tumours had responded significantly. I'd started out with a pancreatic tail of tumour that was 9 centimetres by 5 centimetres. And in my liver, I had other tumours that were about 8 by 5 centimetres and lots of little bits. So there's quite a bit of it around. And they shrunk a bit. So I was then referred to the surgical team under Professor Davidson. And I had 2 operations, one in January and one in April. The first one where they removed the main tumour in the tail of my pancreas, my spleen, because it was overlying that, and a bit of my left lobe of the liver. And then the second one in April, they removed the whole of the right lobe of my liver, which is actually the biggest lobe of your liver. And the gallbladder came with it, because you can't leave that behind. And it's now, the liver then grows back quite significantly, not to the full size, but you know, you're fine, you can live with it. We hoped that might be curative, but it wasn't. But I did have some adjuvant chemotherapy of 3 sessions to sort of try and mop up any remaining tumour cells. So that's, the next thing was regular scans. And then in the summer of 2008, I was put on, because there was small recurrences visible, mainly in the liver and a few nodes, and I was put on into a trial. It turned out for 2 years, from summer 2008 to 2010, I was in the placebo arm, which I had to tell you about. I was a bit upset about what I found out, because I'd had 2 years of 4 weekly injections of saline with this enormous needle into your backside. So never mind. And then, because that portion of the trial came to the end, and those people that were stable disease got moved into the active part of the trial, so I actually went on to the trial with more big needle injections, but this time with lanreotide. But unfortunately, my tumours grew a bit. So come October 2011, I was changed to sunitinib, which was quite new, relatively newish at the time. I stayed on that for 19 months until the side effects really overcame me, and I had 6 months respite, which was lovely. Obviously, the tumours grew a little bit. Then, I mean, they're not big, they're not too bad at all. And then I was started on everolimus, and I'm on that now. I just thought it was interesting, and I looked through because I always ask for copies of my scans, and I found that I'd had 1 colonoscopy, 2 gastroscopies, 1 liver biopsy, at least 7 octreotide scans, 2 PET scans, 1 bone scan, 14 CT scans, and 24 MRI scans. And I think what that says is, thank God we've got the NHS, because if we were in America or something like that, I probably would have been destitute by now. And oh, thank you. So what's it all been like? Well, my initial reaction was what you read most cancer patients go through, this denial. It was denial insofar as I felt it was all happening to somebody else. It was outside me, it wasn't me. It was like somebody was talking about somebody else. I didn't, I still feel that in a way, you know, it still seems strange that it's me that's got it. I did have the why me question. Everybody has that, you know, why not Joe Bloggs down the road? Not quite that pointedly, but you're a bit upset about it. And I wonder what life expectancy might be. And I think that's probably not a very good idea to wonder about, because it's so hard for doctors to say anything really that can be very accurate, unless it's very short, and I'm sure it's not too bad. But I remember seeing Professor Kaplan. I asked him that question and he said, we should get you to 5 and maybe to 10 years. So it's 10 years next January, so hopefully I think I'll go a bit beyond that. The worst time, the really worst time, was waiting to start treatment. I hope the time is shortened now, but I was diagnosed in January, as I said, and I didn't start treatment until the 18th of April. And I hoped to start before then, and I remember one of the worst bits of the whole thing was coming up on to outpatients at the end of March, and they hadn't got all my scan results. And so they said, we'll see you in 4 weeks. And I really thought that was the day I was going to be told, this is when you start your treatment, in, you know, what date. And I was quite upset about that, and phoned someone up the following week, and they said, oh, come back next week, by which time they had the results. And I was started on the 18th of April. I kept a diary. Never in my life, even as a teenage girl, did I keep a diary, but I read somewhere it can be a bit helpful. And I read it actually over the weekend, and I only kept it for that period when I was waiting to start treatment. And it's really quite depressing at times. But I think it did help actually at the time. Family, what's it like for family? Well, my husband, he's very supportive, obviously. He always comes for the results of my scans because he always feels guilty, because the day I actually was told the diagnosis at Luton and Dunstable Hospital, he didn't come with me. And I phoned him up from the car park and said, well, guess what? And I remember we went to the pictures that afternoon and saw a really stupid film, Meet the Fockers or something like that. Meet the Parents of the Fockers it was, yes. He's very supportive, but my point about the family is it's also very difficult for the family. In some ways, I think it's easier for me when I'm going through these things because I can cope with it, but the family see you vomiting, they see you in pain, and you don't want to eat or whatever. And so I do think it's very difficult. I've got 2 sons. The eldest one was at uni at the time, and he was very upset and had to come home for a couple of weeks, mainly because a friend of his whose father had died 2 weeks after being told he had cancer, so that did sort of colour his vision. And the younger one, who was still at school going through all his exams, he just sort of plodded on and said, I'm sure you'll tell me if there's anything I need to know. So it's, you know, what that shows is everybody's different, and you've got to deal with all members of your family in the way that's appropriate for them. I was very lucky with my work. With my chemotherapy and my operations, I was off and on work for about 17 months. I could do some work at home, but you know, and then I went back to work full time, and I stayed there till I retired in 2010. Also, you did say to me I might like to think about early retirement. But I thought I was very negative at the time of diagnosis. Not from you, but from my perspective. You were being honest, but I thought from my perspective, no, I don't think I'll go for early retirement, so I didn't. The side effects of the various treatments, I mean, most of you will know them. I mean, I think the worst things was obviously cisplatin is part of the chemotherapy. I got peripheral neuropathy, which is where you get the tingling and funny sensation in your fingers. So for the adjuvant chemotherapy, I was changed to carboplatin, which doesn't actually do that, plus other drugs. And that eventually went after about 2 years, so I don't have any problems with it now. Sunitinib was fine to start with. They had to reduce the dose, and I think quite a lot of people find the full dose quite difficult from what I've heard. And the thing that happened with sunitinib, why I had to come off it in the end, is because I just got intractable diarrhoea. Just couldn't control it with loperamide. And friends always said I looked quite awful. Now they all say to me how well I look. So I think that's quite nice as well, to be on a drug where you don't look too bad. And then everolimus that I'm on now is actually a piece of cake for me compared to sunitinib. It's maybe diabetic, but that's not a big deal. Take a drug a couple of times a day. So, you know, I'm happy with it so far, touch wood, 7 months in. So what about the future? Well, what I wanted to say is, what's the worst bits of it been? I'll tell you the worst bit, funnily enough, was part of the diagnostic thing where I had the Luton-Dunstable, the liver biopsy. I thought that was really unpleasant, and maybe because it's a huge anxiety element in it as well when someone's sticking needles in your liver several times. The other thing was waiting for treatment, as I said. I've had a few funny things along the way. Funny ha-ha for me, or a bit ironic. I remember after my second operation, when I'd had the right lobe of my liver out, going back for a checkup, and I saw Professor Davidson's registrar, who happened to be French. And I said to her, is it okay if I start having a glass of wine or something? Because I hadn't drunk for quite a while. And she said, everybody should drink good wine. And I thought, whoa, that's all right for a liver person saying that. And the other thing was, when I had my about third or fourth MRI, I get a little bit claustrophobic in lifts, and so I sort of just chill out in the MRI scanner nowadays. But about the third or fourth one, I suddenly got a bit, don't like this. I didn't press the panic button, but I started to take very long, deep breaths, calm me down. And then, and you know how the MRI is, it waits for you to take the breath out before it takes some pictures, some cuts. And then I had the radiologist come on the headphones and say, would you mind breathing a bit quicker or we'll be here all day? So now I just chill out and I actually breathe faster to get it over with quicker, so, you know. And what about the future? Well, as Professor Kaplan has said, there are other treatments out there. When I was diagnosed, sunitinib wasn't there. It might have been in trials, but it wasn't in treatment. Everolimus wasn't there. You said that you did sort of have the radioactive targeted stuff, which is the one I'm going in for next, I think. But, you know, there are more things coming along. I think that's the good news about this cancer, and we're very fortunate there. So I think you've got to sort of keep going. The only other things I wanted to say, I am a positive person. That's easy for me to say. I'm quite an optimist. And if you are an optimist, I think that's so much more helpful. When my husband got a bit depressed about things, I said, you can't do that. We've got to be cheerful and optimistic. But it can be easier said than done. There was no counselling available when I was diagnosed. And I think at that time I would have found it very useful. There is now. You've got the NetPat Foundation, you've got meetings like this, and I'm sure there's other counselling you can go to. So get it if you feel it may help. I mean, I think it can only be good. There are options for treatment. Have faith in the team caring for you. I think the roll-free team is fantastic. And I'm very grateful for all the treatment and help and support they've given me over the years. And always share concerns with them. I remember when I was on sunitinib, I went to see Philippa in the nurse-led review clinic. And when I see the consultants, I think they're very busy. I don't like to bother them with everything, and so I don't mention everything. But she said, well, what else has been going on? I said, well, got hard skin on my feet, and, you know, and I sort of thought I ought to go and see someone about getting that sorted out. And she said, show me your feet. And she said, that's sunitinib. And I didn't know it was. I had corns. I'd never had corns in my life. And, you know, I wouldn't have known that if I hadn't sort of actually talked about every single little thing that I was sort of had happened to me. And it is often easier with the nurses because you feel, with all due respect, I think they have got a bit more time, usually. And so always share it with them and they may have answers for you. So that's all I wanted to say. So just keep smiling and thank you very much.